Senator Pan, your conference has begun.
Thank you, and good evening, everyone. I want to thank everyone for taking the time to join this telephone town hall on the COVID-19 pandemic. I know we would all like to be in the same place for this town hall, but certainly given the circumstances, that is not possible. I would like to also welcome our special guests on this call. We are very fortunate to be joined by two physicians, Congressman and Dr. Ami Bera and Dr. David Lebarski, CEO of UC Davis Health. They are going to join in just a couple minutes, but before they do, I want to remind everyone that if you would like to ask a question of myself or our guests, you can send them or email them to senator.pan@scn.ca.gov. Many people have already sent questions in already, and I look forward to addressing many of those, but I would make note that we probably are unable to get to all the questions in this call before the end of the call. However, I hope that my staff's able to get back to each person who's asked a question and provide an answer. This call is being recorded, and the recording will be posted onto my webpage. Because of technology limitations, the number of people who can participate is capped at 1,400 callers. But for anyone who wishes to listen or share it with their friends, that can be done on my website after the conclusion of the call. My website is sd06.senate.ca.gov. The novel coronavirus was first identified in humans less than 4 months ago and is now a global pandemic. In fact, it was the beginning of this month when the first patient infected by community spread was hospitalized at UC Davis, so only less than a month ago. 2 weeks ago, our school districts in our region decided to close, and it was only last week that Sacramento County and the state of California issued stay-at-home orders. Yesterday, Sacramento County reported 113 confirmed cases of COVID-19 and 5 deaths. And today, the California Department of Public Health announced 3,006 confirmed cases and 65 deaths in California. Also announced today, the United States now has more confirmed cases of COVID-19 than China does. Governor Newsom, in his press conferences, has anticipated that the stay-at-home order will extend throughout the month of April and perhaps beyond. He also projected California will need an additional 50,000 hospital beds to provide care for an anticipated surge in patients over the next few weeks, and he's been working hard to secure those beds. We also have heard recently that over 3 million Americans have filed for unemployment, a record number since they collected this data. We've been taking numerous steps to address this pandemic and its economic, educational, and social impacts, as well as its health impact. In fact, most recently, Governor Newsom announced mortgage relief from most of the major banks, and locally, many of our cities have enacted eviction moratoriums as well. But most importantly, we must all do our part to slow the spread of this infection. Each one of us is on the front line in slowing the advance of this disease. We need to avoid gathering in groups of people. We need to wash our hands frequently. We need to avoid touching our face or wash our hands again to prevent transmission. We also need to stay 6 feet away from other people when possible. If we all do this, we can help protect each other and slow the spread of this disease and not overwhelm our healthcare system. So I would like to now introduce our guests on this call. As I mentioned, we are lucky enough to be joined by Congressman Ami Bera, who represents California's 7th Congressional District in the House of Representatives. Like me, he was a doctor, and he still is a doctor, and then ran for elected office. Before he was in Congress, he was the Chief Medical Officer for Sacramento County. He put his medical experience to work for our community, and I feel very fortunate to have him in Washington, D.C. representing us, and also fortunate to have him on today's call. We are also very lucky to have Dr. David Lebarski on today's call. Dr. Lebarski is Vice Chancellor of Human Health Sciences at UC Davis and the Chief Executive Officer of UC Davis Health. Dr. Lebarski is not only a leading voice throughout California's medical community, but through our region and in our entire state. He has positioned UC Davis Health as a resource to our region. I also want to thank him for taking his time to be on today's call. So I thought I'd begin with Dr. Lebarski and ask you, what is the status at UC Davis Health? Are you seeing an increase in ER visits and admissions for COVID-19 at UC Davis Medical Center? And also, what are you hearing from the other hospitals in our area in terms of admissions. And so what are we looking at this coming week or 2 weeks?
Right. Well, right now, actually, the level of uptick, while there, is nowhere near that of New York or the other things that you're seeing on CNN. We currently have approximately 11 COVID-19 positive patients in our hospital, but we have 623 hospital beds, so it's a very small fraction. The rest of Sacramento is not that much different, and the current time in terms of how quickly this virus is spreading is less than that of other areas in California and less than that in New York. So I think it's going to be a little while, that is several weeks at least, before we really see the major uptick that some other places have seen.
Well, thank you. That's actually good to hear. Now, we know that as we are doing the stay-at-home orders, that many people, as I said, are filing for unemployment. Small businesses basically have shut down. So, Dr. Berra, I know you're working hard for us in Congress. I think tomorrow there's supposed to be another package that's coming before the House of Representatives. Can you fill us in on what we can expect and what kind of help we might be able to get?
Great. Thanks for that question, Richard. We do expect to have debate on the floor of the House tomorrow, and hopefully a voice vote. Members are scattered all across the country, so the hope is that you could do this either by unanimous consent or a voice vote. It was passed unanimously in the Senate. That said, if a member calls for a roll call vote, then we're all prepared to fly back to Washington, D.C., although we want to follow the same orders we're giving folks about staying at home and making sure we don't spread this virus. This is the third bill that we're passing to really try to help the recovery. The first bill we passed a few weeks ago was really aimed at trying to get resources and supplies out to the hospitals, the doctors, the providers, the folks that are on the front lines. The second bill we passed that the President signed into law 2 weeks ago was focused on the workers, the folks that were hit hard by this, the school children that were sent home, et cetera. This bill focuses in on the businesses, small and large, along with the workers and other individuals. And without getting into the granular detail, and we will post all of this on our website, berra.house.gov, as to where you can get help. It really is in three tranches. One, as Dr. Gorski clearly knows, the hospitals and the healthcare delivery system are taking a major hit here. So there's $100 billion in there to help shore up our hospitals, help make sure they've got the necessary resources and services to care for us. And then also there's funding for community health centers, additional funding for protective equipment, tests, et cetera. So we're pushing all that out to make sure when this wave hits, the folks on the front line have what they need. In addition, we know so many small businesses have been hit very hard by this, and many face the grim decision of having to close or go bankrupt. What we've done in this bill is make sure we can deliver relief as quickly as possible to those businesses in the form of loans, but those loans are forgivable loans. If our intent is we don't want those small businesses to lay off their workers. We'd like to keep them employed, and we'd like to help cover the cost of some of those payroll benefits. So if they do keep their workforce employed, they will have the ability to forgive some of these loans and over time based on the amount of the workforce that they keep employed. Again, the idea there is if we can keep people employed, even if they have to stay at home, and we can offset that cost or offset the full cost of it, then when we are able to safely get back to business, folks have jobs that they can go into, and hopefully those businesses can get started very quickly. Another area, we know that there are hard-hit industries like the airline industry and others. So there's funding in this for some of those industries. We want to make sure those dollars for big employers go to the workers as well, that protect folks from being laid off. And we want to protect and make sure it doesn't go to stock buybacks or CEO bonuses, which we saw in 2008. And so we've put in those protections, but we also know it's important for us to protect the tourism industry, the hotel industry, the airline industry, and others that we know are going to be hit pretty hard by this. And then lastly, one thing my office fought for, and we were glad that we got it in there, is we know we have a homeless crisis. And kudos to Sacramento County and the city of Sacramento for stepping up and protecting renters from being evicted. We were able to get into this bill, a moratorium on evictions along with some rental housing assistance. So, those details will be coming out, but I'm glad that at the federal level we were able to get that in there. My staff is going through this bill. It's 800 plus pages. My sense is there'll be an overwhelming, if not unanimous vote in the House to pass this bill. We know Americans are hurting. We know Sacramentoans are hurting, and we need to get that relief out there as soon as possible.
Okay, thank you, Ami. Appreciate that. And we're all looking for that help, so appreciate it. So I'm going to go to some of the questions we've received. So Joe has said that I've heard that hospitals have admitted many people who had presumed cases but have not been tested or are waiting for test results. And there are many others who have contacted their health providers and been told their symptoms are not serious enough to warrant a hospital visit but may have the virus. What is your sense of the real number of people who are infected? So I guess I'll take a first crack at that and then see if either one of my guests wants to add on. We do know what we are behind in testing here in California. We've been ramping up the number of tests. I would make note that actually the number of tests that were conducted that was reported to the Department of Public Health between the day before yesterday and yesterday actually doubled from under 30,000 to over 60,000. But we know we need to do much more testing. And so, yes, we anticipate that there are many other people out there. Some people project as much as tenfold who have been affected beyond what we actually are reporting, which is actually the number of confirmed cases per test. And that is why this physical distancing and everyone needing to do their part is so important. We know that 80% of people who are infected may have either no symptoms or very mild symptoms, which could be confused with other infections like colds. And in that way, we almost have to assume everyone might be infected, and so that's why it's important that everyone do their part in trying to slow the spread of the disease, because we just don't know who actually has the infection or not for sure.
Richard, maybe I'll.
Yep.
David, you want to take, or maybe I'll take the federal perspective on testing,
okay,
and then
yes.
kick it over to you, David, for the local perspective. I do think this is one of the failures of our response. 6, 7, 8 weeks ago, we were sounding the alarm when we were seeing what was happening in China, saying this is coming to the United States. You can institute a travel ban on China, but it's not going to prevent a virus. A virus doesn't know nationality. It doesn't know religion. It's a virus. So we knew it was going to hit our shores. And, and I know Tony Fauci and Director Redfield from the CDC and others, they're good, smart people. I don't know if they were listened to or not. But that said, 6, 8 weeks ago is when we should have been ramping up the testing. It was unfortunate the CDC did try to develop their own test. They indicated they had sent it out to every state and every state lab, but unfortunately that first test didn't work as well as they hoped it did, and that cost us some time. I do think we are starting to ramp up and get there, but unfortunately we've lost time here. We still need that diagnostic testing ability. And I think Dr. Lebarsky can probably talk about what he's seeing on the front line.
Right. So echoing, well, before I say anything else, I just want to say that I think that the slower uptick here in Sacramento has a lot to do with the early action by the mayor, the county, and the state in issuing the shelter-at-home orders here in the Sacramento area. And nothing could be more important to stopping the spread than continuing to adhere to that. Having said that, the lack of testing, it does make it more difficult to make good decisions. At UC Davis, we finally are online with our own tests that we developed and in-house because of the lack of delivery of goods that were CDC approved from others. And we have very few patients in-house that we have not tested. Of interest, only about 1 out of 20 individuals who are admitted to the hospital with very severe influenza-like symptoms or pneumonia that we think might be COVID-19, only 1 out of 20 have tested positive. So the numbers are relatively low still, and the ramp-up of testing is still slow, and that we are working on. That is, we have a very high throughput machine that could test as many as 1,400 patients per day that we are just simply waiting to activate because the testing kits are just slow to arrive in California. As a matter of fact, every UC has this exact same testing capability. And if we were to be fully supplied by Roche, which is the company that makes these testing kits and made our machines, between just the 5 UCs, we'd be able to test 7,000 people a day. And so as it is, starting next week, everybody in the UC system should be able to be testing at least 200 people a day, but that's far below our capacity.
So, David, let me just follow up on that. Natalie asked the question, what is California's current status in getting more tests developed for COVID-19? She also asked about Verily, who is actually here in Sacramento. They're providing drive-through screening as well. And I should mention that they said that they are ramping up their availability, but they sort of start with a smaller number and then gear up. And then Frank also asked about serological testing for antibodies as an alternative as well. So, David, can you just speak to, because you mentioned the part of the issue is, for example, you said reagents or supplies. We've also heard about the lack of swabs to be able to take samples. What seems to be the holdup in supply chain here for testing? Is that the main reason we can't get tests, because of these supply chain problems?
Yes. I will say this. I'm going to give a shout-out to Blue Shield of California because they heard about the swab issue. They made contacts in South Korea where apparently there doesn't seem to be these same problems, and they're supplying all of the UCs with swabs and transport mediums so that is no longer a rate-limiting step as of next week. But without their help, that would have been another rate-limiting step. And it's good to see various parts of our healthcare system stepping up and helping. The answer is that, frankly, we really need a supply chain czar to be looking at all of the rate-limiting steps that prevent us from getting all the tests that the people of California and the United States deserve. And that continues to be an issue. And you can make 1 million of one thing, but if you don't have 1 million of the thing that comes before it, it doesn't help. And that's kind of where we have found ourselves, which is frankly sort of manufacturing supply 101, and people just not really doing what needs to be done at a coordinated level at the federal level. So I'll just leave it at that.
Okay, so Congressman Vera, we just heard federal level. I know the state, unfortunately, doesn't have the authority to commandeer manufacturers to produce things. We hear about coordination. So what are you hearing at the federal level? The president has sort of teased about using his authority, which he does have, but has actually not been willing to exercise it. Do you have any news for us about what we could do? Yeah,
I don't know that the president listens to me, but
he should.
For weeks we've been pushing the president to invoke the Defense Production Act, and use his authorities to really focus in on this crisis and this pandemic that is on us right now. The fact that he's still not doing it, and it sounds like they are going to start compelling people to manufacture the test kits that Dr. Lebarski so quickly needs, and allowing the commercial sector and the private sector to step in. That should have happened weeks ago. Yeah, I've also been in conversation with the South Koreans using my relations. So I think it's possible that they will start shipping test kits to us as well. And we pass that information on to the health systems as well as the governor. One of the previous questions, though, was also about serology. And I think that's something that's really important. You're going to hear us talk a lot about testing, and there's diagnostic tests, which are the nasal swabs that will tell us whether someone has the infection or doesn't have the infection of COVID-19. But there's serologic tests, and that's a different test. And we already have the serologic test now. I talked to a doctor over at Mount Sinai that's developed it, and he's providing that information freely. I think Berkeley and Stanford have it right now, and if UC Davis doesn't have it, we'll make sure you get it. And then the commercial sector is developing pinprick technology, so we could quickly do a surveillance of our community and see who potentially was infected, recovered, maybe never knew they had COVID-19, and now has antibodies and some level of immunity, some level of protection. That will be one of the keys that we have to use to get a sense of how prevalent this is in our community. And again, not a difficult test to develop. We just have to be able to ramp up the ability. It's not a nasal swab, it's a blood test. And I'm told that the technology allows us to do a pinprick. You don't need a lot of blood. And that will be incredibly important in our deciding when it is safe, at least for portions of our community, to go back to work.
Okay. Oh, thank
Richard?
you. Yes.
Sorry, I just want to make it really clear that when I said federal lack of responsiveness, that was the farthest thing from the truth when it concerns someone like Ami Bera or Doris Matsui, both of our Sacramento representatives in Congress. Just incredibly responsive, incredibly responsible about what's the right thing to do. And Ami, I just want to say thank you because your leadership and your physician knowledge on the floor of the House is incredibly important because you do understand all of these issues.
I appreciate that, David.
All right. So let me move on to some additional questions here. So I have a cluster of three that all have to do. So Rory said, at what point does the threat of a financially devastated community and all its subsequent consequences supersede let's see here, the pandemic, and are we simply trading one problem for another? And then Gino actually asks, why has the government chosen to implement a voluntary shelter-in-place instead of quarantining neighborhoods by closing roads and testing residents? And then Barbara said, I'm so concerned about Trump's plan to lift restrictions that are so necessary too soon, and is California obligated to follow suit, or do you have confidence California will do what it takes to flatten the curve? So I think you hear this tension between some people are concerned about the economic devastation that they're seeing around them because of the stay-at-home orders and so forth. At the same time, people are, of course, worried about continued spread of this disease. And I would make note that the stay-at-home orders are actually, due to the Constitution, are actually powers given to the states and local governments. So that would be a decision by either the governor or by different localities that have also implemented them. So the president can't lift them. He doesn't have the power to lift them himself. But certainly people have raised concerns, is this infection really that bad? Certainly I think what we do know from projections on this disease that there's currently a death rate of, I think right now in the United States it's about 2%, You can correct me if I'm wrong. I think in some countries it's been as low as 1 and as high as 5. And so when you start thinking about having large numbers of people infected, if it's been projected that if we let this disease run, this infection run through California without making efforts to slow it down, we would have over 200,000 deaths as a result of this disease, and possibly even higher because more people would die, because if the healthcare system's overwhelmed, then not only, of course, people are infected with COVID-19, but other people who need hospital care who can't find room in the hospital would then potentially be at risk as well, because the hospitals would be so full. And that's the trade-off. I think many of us are not willing to sacrifice lives to lift the economic, the stay-at-home order. And also that as people are dying, generally that's not going to entice people to go to restaurants or actually engage in normal business when you have that much death and devastation going on in terms of people's health or risk to people's health. But that would be my observation. I don't know, Dr. Barrett, do you have some thoughts as a physician? And then maybe we'll have Dr. Lebarski from his perspective as someone who has to actually run a healthcare system.
Sure, absolutely. And here's how we're thinking about it from the federal level. We're looking at the experience of China, South Korea, Japan, Singapore. Each took a slightly different approach, but we've learned a lot from watching the spread of disease in those countries. And as of today, the United States has more cases than any other country in the world. So the absolute right thing to do right now is to stay at home. And that accomplishes two things. One, it does slow the spread of disease, but the most important thing it's doing is it is allowing to create those contingency plans if their hospitals get full. What are
Ami, I think you're breaking up.
Folks, can you hear me now? Is that better?
Okay, that's better. I think,
Rich,
yeah.
Is that better? Okay.
Yeah, that's better.
Sorry about that. So the stay-at-home order is incredibly important because it's buying us time right now, and it's allowing the doctors, the nurses, the hospitals to create capacity to take on this surge, as well as it is buying us time to try to get that protective equipment to the front lines, to the first responders, the folks that are heroes and going to work every day. We don't know how long it'll be necessary to have that stay-at-home order. Folks that are worried about this, look at what's happening in New York, what's happening in Italy, where the hospital systems have been overrun. We don't want to see that in our backyard or anywhere in America for that fact. We also, at Congress, we're very conscious of the economic pain and despair that losing your job, losing your business potentially causes. That's why it's so important for us to get this economic package passed as quickly as possible and get those resources to the folks that need them and hopefully cushion that blow. But the last thing we want to see is lifting the stay-at-home orders before we've actually gotten past this potential wave. And that's the danger, because we also are seeing in Hong Kong, where folks have started to return to work, a second spike and a second surge. And, we put a premium in California and Sacramento on the health of the people that live here. We recognize we've got to balance the economic vitality with the personal safety, but let's let the science and the facts dictate when it is safe for folks to go to work. And that's where that serologic test can really help us. That will let us know if people are actually immune to this. They've had the disease, they've developed antibodies, and now they're immune, which will then help us guide when it is safe for certain communities to return to work. So I don't know, David, do you want to add anything to that?
Yeah, well, no, I think that's really wise advice, Ami. And now is not the time to be lifting the shelter-in-place orders. Right now, the hospital systems, at least in our local area, are prepared for the surge. We've reduced a tremendous amount of our elective and even almost essential care so that we are ready for this and we can take care of the people who are going to come to our emergency departments. The last thing any of us want is to see the health systems overwhelmed. 50% of the people hospitalized are below the age of 65. And while they don't represent a large portion of those people who end up dying, they are actually quite sick. And recent publications that came out in the last couple of days suggest there may be some permanent long-term damage to their heart muscle. So this is a serious disease, even if you are not elderly. And we need to protect everybody. And even if it only affected people who were elderly or who had coexisting diseases, as a humane society, as people who love our parents and our aunts and our uncles, we have an obligation to take care of them the way they take care of us. And I am personally offended when people say, well, it's just the old people. It's not. They're our people, and they're our parents, and they're our loved ones, and we need to do everything possible to protect them.
Okay. So, no, thank you for that. I appreciate you mentioning the fact that while we often, yes, the oldest people and the people with pre-existing conditions are at highest risk for death from this infection, but we also know, for example, over half of all the people who are identified as confirmed positive for COVID-19 are actually between the ages of 18 and 64, so the younger set, and the hospitalization rate I think has been somewhere around like between 10 and 20%. I think more around 14%. I don't know what the most recent numbers are for the United States. So you still have a significant risk of hospitalization, even if you do survive from this disease. Now, one of the questions that from Jeff about UC Davis staff testing positive for COVID-19 and asking about basically the level of the availability of personal protective equipment and masking, and the level of and how many, are we do we have enough PPE, and some people have raised the question of, are we limiting PPE because of supply issues and not because of the best protection? So, Dr. Lubarsky, do you want to address the issue of PPE both at UC Davis, and then perhaps if you have any observations in terms of overall supply for hospitals in the region?
Sure. So I think that first and foremost, it's important to say that right after the health and well-being of our patients, nothing is more important than the safety and the health and the well-being of our employees, our faculty, our students, and our trainees. We are in no way limiting PPE, at least at our organization, except for appropriate use. And appropriate use is defined by the science, which is how do we make sure that caregivers who come into contact with COVID-19 patients are protected from acquiring disease. This has been pretty well worked out. It's really by droplets, which means when you cough or you sneeze or you spit, the virus is carried in that. If you're just normal breathing, it is not carried via that mechanism. You do not transmit it through the air. So therefore, the type of protective equipment that you need is very different with something, say, like the measles, which is carried through the air, versus something like the coronavirus. So understanding the science is critical. Right now, most of our organizations are fairly well-equipped with inventory. I can only speak specifically to UC Davis. I don't know all the inventory around the entire system, but we are well prepared. We've been preparing literally since the first case was reported to start creating some inventory that would allow us to deal with the expected surge. And so I'm very confident that we have the right protective equipment. I would always like to have more. You always want a little more money in the bank, so to speak, to weather a downturn. But we are not limiting our personal protective equipment and constantly seeking new ways to get around the supply chain. The supply chain is limited, and replacement is difficult. And right now, orders from China, which is where most of this stuff is made, is now 10 times as expensive as it was 2 months ago.
I appreciate. Thank you. And I know that one of the things that been having conversations with folks at UC Health overall and some of the other places about trying to ramp up domestic production, not just relying on overseas suppliers for this. Congressman Barra, did you have any additional comments to this? I know we already touched about supply chain related to testing and so forth. What about PPE? Any additional comments about PPE?
Yeah, we're providing billions of dollars to allow the hospitals, the clinics, and those frontline workers, first responders, to get the PPE that they need. That said, you need places to buy that from. And, two things. One, again, we touched earlier on the president utilizing the Defense Production Act. I think now is better than never. So, direct some of our garment manufacturers and others to make that protective equipment that our providers need so badly. And then two, long term, when we get through this, I think it really does expose the issues that our supply chains have in terms of over-reliance on China. So, it does bring up the issue of bringing back domestic production here to the United States.
Okay, thank you. So Daniel, he said, my wife's recently discovered she's been exposed to COVID-19, and she's developing a dry cough and some other symptoms. At what point is a decision made, if indeed is appropriate, to seek help at the emergency room versus continuing recovery in self-quarantine at home? So at what point should people actually say that, okay, I need to go see a doctor or show up in the emergency room in relation to, because I'm worried about this disease and I actually had a contact with someone who may be positive. So maybe we'll, so Dr. Lebarski, you want to take that one on first?
Sure. Well, the problem right now is that testing has a 5 to 7 day turnaround for most people who are not very sick. So going to your doctor and getting a test is good, but unfortunately you're going to be kind of out of luck. So if you have, that's just the way it is, and I apologize for it. I wish it weren't that way. So if you have symptoms that seem like a flu, the odds are overwhelmingly still that you have the regular flu. But since you don't know that, then just like you would do, and this is why there's not much being done differently, if you have the flu, you stay away from your loved ones, you don't cough or sneeze on them, you wash your own hands frequently, you cough into the crook of your elbow, not into your hand, and you really try and not give that to the people who live with you. It turns out coronavirus is a little bit more infectious than the regular flu, so taking extra precautions at this time to pay attention to that is really important. When do you take yourself to a doctor? If you begin to experience any shortness of breath, or if you happen to have be immunosuppressed because you have cancer or a autoimmune disease and you're taking medications, or if you're very elderly, an earlier than a later visit certainly probably makes more sense, just because you're at higher risk if it turns out to be the coronavirus. So that would be my suggestions. But if you're just a normal-aged, not an older adult, but a middle-aged or younger adult, and you have flu-like symptoms, self-isolating at home right now is probably the best thing to do until we have widespread testing.
And let me just follow up on that. So one of the things we're definitely telling people is that before you go show up somewhere, like your doctor's office, please call in advance because, again, I think doctors are trying to limit the spread of diseases in their waiting rooms. Does that also apply to the emergency room? If you feel like you're so sick you need to go to the emergency room, should you just drive up and show up, or should you call ahead?
Well, if you call ahead, it's always better. We have, right now, at least at UC Davis, we have a mandatory triage for our outpatient clinics where we talk to you, we inform you you take your symptoms, where should you go. If you're going to go see the doctor, we alert the doctor's office so that they can meet you at the door, put a mask on you, and make sure that there's social distancing in addition to that from other patients in the waiting room to provide maximal protection where literally it cannot be spread. In the emergency room, we actually have created a special triage unit for exactly that same thing. So whether you call or show up, you will be immediately whisked off to an area where we evaluate people who have influenza-like symptoms and not mix you with people who are there for a broken leg or a car accident or something like that. To date, to be quite honest with you, very, very few patients are testing positive for COVID-19. I think the last number I looked at for people who walked in for outpatient or in the emergency room was somewhere about 2 to 3% who were actually testing positive. So it still is relatively rare and extremely likely. Relatively rare it's coronavirus, and extremely likely that it's just simply a bad cold or the flu still. And we hope that that will continue to be the case, although it's likely those numbers will change in the future.
Okay. And again, that's probably that's Sacramento specific, correct?
That is Sacramento specific, yes. I think I'm assuming most of the callers calling in are Sacramento specific, so I've been focusing on that. If you're in New York, it's a totally different story, and if you're in the middle of Arkansas, it looks like it's pretty close to zero right now.
Okay. And we always remind people, wash your hands frequently. That works for coronavirus, that works for flu, that works for the ordinary cold, many other things as well. So Congressman Bera, I'm going to call you Dr. Bera. This is more a doctor question than a congressperson question. Did you want to add on to that?
No, I think I would just follow what David said. If you're relatively young, healthy, having slight fever, having slight cough, the best thing to do is probably just to distance yourself, practice good hygiene, and make sure your rest of the family doesn't get infected. So.
Okay, great. Let's move on. So I have a question from Lisa, who asked, why are so many groceries still unavailable? Are people still hoarding? What can be done to stop them? So we've had issues of hoarding. People talked about how they couldn't find toilet paper, wipes, other types of things. And I think the governor's spoken to this as well. I mean, you buy what you need. We sometimes have told people buy a little more so that you don't have to go to the stores often, so you can stay at home a little longer. But keep in mind there's other people who need these things as well. So far, I want to, again, thank all our frontline workers, the truckers who are delivering the goods, the people working in the grocery stores who are stocking the shelves, the cashiers who are helping people, et cetera. I mean, they are essential workers. They're out there doing their jobs to be sure our stores are stocked and that people can get their supplies. But it also means that let's not go overboard in our purchases in a way that then causes shortages for other people. Buy what you need. Actually, Dr. Bera, do you want? And you're as a congressional leader, what would you say to people about the hoarding issue?
Let's look after one another. Certainly people are concerned. There's anxiety. There's some level of.
Oh, sorry, I'm going to ask you that. Yeah, the connection's somewhat bad. Sorry.
Oh, is this better?
That's better. Yeah. Yes.
Okay. So, look, we're all in this together. We're a community. We're a country. Let's look after one another. Obviously, there's anxiety. There's some level of fear. But now's not the time to go out and buy excessive amounts because your neighbor, other community members are also going to need those supplies as well. So buy what you need. And I was talking to the Sacramento Food Bank today, and their ability to distribute food and serve these increased needs. There's 150,000 folks on a normal day that need support. They're seeing increased capacity, and if those resources aren't available to help the neediest of us, then it's going to impact all of us. So we're all in this together. If we stick together, if we do our fair share. That's not to say don't go out and get the groceries and take care of your family, but don't overextend yourself. And we will get through this, but we will get through it sooner if we're in this together.
Great. Dr. Lebarski?
The supply chain for food and products in the United States is perfectly good, unlike personal protective equipment, which comes from China. And the hoarding is actually the issue. And if we just buy what we need, there will be plenty for everyone, just like there always was. And, and as Dr. Barra and Dr. Pan have said, we're in this together. If we just think like everybody is part of our family and do the right thing, we will get through this and maybe even be a better and stronger country for it on the other side.
Okay, well, thank you. We are starting to approach toward the close of our time together here for our call. I do want to thank you both, Congressman Barra and Dr. Lebarski, for being very gracious of your time. I know both of you are very busy. Congressman, you have a vote to take up tomorrow morning, and Lebarski, you're running a very important health system for us, so I appreciate your leadership, knowledge, and all the efforts you are making preparing us for the pandemic. I would like to, though, also give you an opportunity to make any closing comments you would like to share. So, Congressman Barra, would you like to make some closing remarks about what we should be doing about this pandemic?
Sure, absolutely. First off, we're blessed in California to have strong leadership from the governor to our state senator to our congressional delegation, assembly delegation, to our mayors in this region. So, everyone really has stepped up to the plate. I think the quick action of the governor, the mayors, and local leadership, hopefully we are going to see a wave, but hopefully it dampens that wave a bit and allows us to get through this without seeing what we're seeing in Italy or New York City right now. That said, plan for the worst, hope for the best, and we are planning to do everything that we need to do. The second piece is there's a silver lining here. You really are seeing everyday heroes in the nurses, the doctors, the first responders, folks that really are exposing themselves to risk, but who understand the job at hand and are really getting out there to keep our community healthy and safe. So our hats off to them, and we can't thank those individuals enough who are keeping us safe every day, especially now, though, when they're putting themselves in harm's way. And third, you're seeing the kindness of our community. I see neighbors looking after some of the elderly or some of the folks that are immunocompromised, et cetera. Let's keep that spirit going even as we get through this. That is what is going to get us through this. If we're in this together, if we're looking after one another, yes, we'll suffer some hardship, but we will come out of this quicker and stronger. So let's be Sacramento strong, and let's make sure this happens. Be safe, be kind to one another, and be well.
All right. Well, thank you, Congressman. Dr. Lebarski.
Now, I'll just echo some of what Ami said, which is that we are in this together, and that the frontline caregivers, the doctors and nurses in those emergency departments, the ones in the ICU taking care of the most critically ill COVID-19 patients, actually they take care of critically ill people every day. But when they deal with COVID-19, they have to worry not only about their own health, but the health of their loved ones when they go home. And we're very sensitive to that. And yet they all come to work and they all do what's right and they all take care of us. And so how can you take care of them? Well, you can make their life a little easier. You can stay home and not spread the disease. You can practice incredibly careful hand hygiene. You can actually give blood. One of the things that we're facing is a critical decrease in the blood supply in this city because everybody has stayed home, and that's great, but that's including not going to blood drives. I personally went to our local blood drive on the UC Davis campus this afternoon, gave blood myself. It only takes a short while, and there are other blood drives around. We really need people. That's an essential service. You're allowed to leave in order to to give blood. And I encourage everybody, that's one way that you can help us continue to take care of you, which is to make sure that we have the resources that are necessary to do great medical care, not only for COVID-19, but for anybody who needs our help.
Well, thank you. Now, I just wanted to make note, as I started out in the opening, mentioning the fact that we were actually here in Sacramento taking care of the first patient who was infected through community spread, a patient from Northern California who was hospitalized at UC Davis. That was just 3 weeks ago, and here we are. I would note that many other parts of the world and even parts of the United States have accelerated in terms of the number of cases beyond us, with the caveat, of course, that we could do more testing. So we're working on that, and we have greatly expanded the amount of testing we've done. We still need to do more. The next couple of weeks, we may see increasingly grim news in terms of a rise in cases, some of that due to more testing, but some of that also due to greater spread of this disease throughout the United States and parts of California, and maybe even here in Sacramento. At the same time, the steps that we took, as I mentioned a week ago, to ask people to stay at home, and the Bay Area was a few days ahead of us, then we were there, is making a difference. We may not necessarily feel that difference when the number of cases start to pick up, because there's usually a couple-week lag, because you think about it, when you get infected, it takes about a week before you start developing symptoms, and then people get sicker, and then they end up in the hospital. So we've only been a week since we did the stay-at-home order, but we are working hard to flatten that curve, and what I mean by flatten the curve is being sure that we don't end up with so many cases that our hospitals and our nurses and doctors and other healthcare providers aren't able to take care of everyone because there's just so many of them. And so we need to keep persisting in what we're doing. I think we're seeing signs that it's working. We do see signs in other parts of the world that this works. In the meantime, while we're doing that, we need to expand testing so we have a better idea what's going on. We need to get more personal protective equipment for the people who are taking care of us so that they can stay safe. And I appreciate that UC Davis Health and many of our has already been preparing for this coming up, and certainly, but we do hope that there's greater steps forward. At the same time, even as we're figuring out how to respond to this disease, we also need to respond to the fact that people are suffering economically. Our kids aren't at school. People basically need to make a living, and small businesses may not be having income. People have been laid off, and so it's important that our government work to provide relief. Looking forward to passage of this bill that's coming up, as well as thank you for the previous two, Congressman Berra. I understand you had mentioned that there's more on the way at state as well. We've allocated $1.1 billion for the governor for initial response to provide housing for people who may be homeless, to get more hospital beds, more ventilators, et cetera. But we can do this, and we can get through this, and I have confidence here in the people of the Sacramento region, and I've had the pleasure and honor of working with our local elected officials as well as my colleagues at the state and the federal level. And again, I want to echo Dr. Lubarsky. Thank you, Congressman Berra. Thank you, Congresswoman Matsui, our U.S. senators, for the work that all of you are doing to help us at the federal level. Mayor Steinberg, Mayor Cabaldon, Mayor Lee, other mayors, city council members, boards of supervisors members. We're all working together to try to keep people safe. But more importantly, all the people who are actually on the front lines, our business owners, our the people who are working in our grocery stores and helping truck the supplies, and who are just our healthcare people, the doctors, nurses, the clerk at the front, the respiratory therapists, everyone, our teachers who are doing distance learning, so many people. It's all because we're all pulling together, staying at home, but still trying to help contribute to our community. I also want to mention that we have our Donate for Sacramento campaign to help raise funds to help people in need as well. And, of course, I want to thank the generosity that many people have donated to that. So we can do this all together, and I want to thank everyone who participated in this call and all the people who have sent questions. I know that there are many questions we weren't able to get to, but we'll try to get those answers for you as well. This is it's really important that we get you accurate information, and look forward to continuing to do that, and for all of you who are listening on this website, you can listen to this call on the website. For the people who couldn't join us, you can listen to this on my website, and also we can get you additional information. So, again, thank you so much, Congressman Vera. Thank you so much, Dr. Lebarski. I want to thank everyone who's participating in this call, and I look forward to continuing to work with all of you. And please, everyone, please be safe. Let's be together apart. And each do our part on the front lines to prevent the spread of this disease. So thank you so very much, and I look forward to working with everyone. And so this concludes this town hall. Thank you.